Is there a correlation between the size of a pregnant woman's belly and the size of her baby?
Hello, and welcome to today's topic. Today, we're going to discuss a question that piques the curiosity of many, especially those expecting a baby. Is there a correlation between the size of a pregnant woman's belly and the size of her baby? Let's dive in.
Understanding belly size during pregnancy.
The size of a pregnant woman's belly can be influenced by numerous factors, which often leads to a wide variation in belly sizes. Some of these factors include the woman's body type, her muscle tone, the position of the baby, the amount of amniotic fluid, and whether or not she's had previous pregnancies. It's also important to note that the belly size can change significantly during the day. This is because the baby moves, and the amount of food and fluid in the woman's system also fluctuates.
Does belly size indicate baby size?
Contrary to common belief, the size of a pregnant woman's belly does not necessarily reflect the size of the baby. It's quite possible for a woman with a compact bump to deliver a large baby. On the other hand, a woman with a substantial belly may have a relatively small baby. This is because the size of the belly is more about how the baby is positioned, the amount of amniotic fluid, and the mother's own body rather than the baby's size.
How is baby size estimated?
Healthcare providers usually estimate the size of the baby using fundal height measurements, ultrasounds, or both. The fundal height is the distance from the pubic bone to the top of the uterus, which usually corresponds to the number of weeks of gestation after the 20th week. Ultrasounds use sound waves to create an image of the baby and can be used to estimate the baby's weight and size. However, it's worth noting that these measurements are estimates and can be off by a pound or more. In conclusion, while it might be tempting to use the size of a pregnant woman's belly as an indicator of her baby's size, it's not a reliable measure. The belly size is influenced by a host of factors, many of which have nothing to do with the baby's size. Remember, every woman's pregnancy is unique, so it's always best to consult your healthcare provider if you have any concerns or questions. Thank you for watching, and we hope this has been informative.